it would be more interesting for you all to ask some questions. Again, I'm Susanne Killian. I was going to talk a little bit about kind of like the career landscape, and I think that's important, although I know a number of you all are maybe, how many people are going to be a practitioner, provider, doctor, pharmacist? Oh my goodness. I know I've got some med people in here. How many of y'all are in public health? Something of that sort, and many in business, I'm presuming. Okay, so I like to talk about this in two levels. The first one is, are folks who might be providers or be going into like the workforce, providing that health care. I encourage you to do so. But there are chances for you to have blended careers. So that's why the business piece is so important, for you to know business, not just for a blended career, like you might be a consultant later on, you might work for a pharma company, a CMO, something of that, a chief medical officer, but the fact that you'll be a better practitioner and be able to innovate better if you have the business principles. Now, on the other hand, we've got the business folks. Now, the thing is that you might want to go out, you might want a career in healthcare. How many people are just healthcare curious? You just showed up today like, this might fit into my function. So functions such as accounting, finance, folks that might be in marketing, commercial. Healthcare is so huge. There are going to be jobs there. So that's why I say put that also into your toolbox. Because if you have a function, say, finance, you might start in investment banking. But in investment banking and in any finance, we just saw how much is being spent on healthcare. You don't think that's going to leach into your job? Absolutely. So we want you to be prepared. And as you see, I think healthcare sounds a lot like dating. Many of y'all are doing that. I don't know, it's complicated, or, at the end there, it's just kind of like a black box of it's a lot, So again, too, for you to understand some of these pieces, I think is super important. But I want to share with you some resources here at Keenan Flagler and then across campus. So again, I'm going to toot our horn. We're the UNC Center for the Business of Health. How many of y'all have been to any of our events before? You folks? Okay, so we offer a lot. This is just the first kickoff of many coming during the year. We offer many that are virtual, so that even if you are in the clinic, I'll have many times where people have their camera off, their sound off, and I'm like, ooh, they're in the clinic, and they'll chat their questions. So we'll have those, but we also have our wonderful healthcare conference every year. We have case competitions. We've just got so much. And so as you heard from Dean Stats already, that we really want to bring people together, and that is so important. So right here, this is important. I have this also out in the other room, so if you want to get the QR code here, you can get it there. You can also just look up CBOH Career Networks, and bam, I don't know, it's probably tagged so much on mine so it comes up first. But it's a place where you can learn and explore. So we give you some general information like grab and goes to learn. Again, you can see all of our events, but what is really awesome is we have, oops, and I don't think I put it in here, but we have warm connections that are just ready for you to go ahead and connect with. So you can kind of look through the folks' profiles, you can send in your form, and then we'll connect you with many of our folks in our 7 verticals, which you can see on Career Networks. Again, too, now I have a newsletter, but Erin and I'll talk a little bit about that later on, about if I can email everybody anymore. But I usually send out a reminder, so if you get on my newsletter, anything that we do, I just kind of send you just updates so that you know things are coming. So I'll pause that for just a second. And again, too, I'll send you information. Anybody on this list, just email me and I can send you additional info. Now, we are having our CBOH, this is a long name, Interdisciplinary Business of Health Student Committee. We just call it the IHC. This started because I'm also the IPEP director. I'll talk about IPEP in 2 seconds, but really for only 2 seconds. But our president for the committee is here. Walter, I'm sorry if I'm going to focus on him. But just what Brad was talking about earlier, about convening. And what we really want to do is get folks together, like right here today, to talk about these things, because we didn't get to talk about them very much. So we actually want to have opportunities for students to get together, to meet professionals that are working on these really complicated pieces of healthcare. We want to do some site visits. We also just want to have like sessions where people get together and talk about the interest in healthcare, because your friends probably get bored. Like, how many people go and that you're so interested in talking about some really deep healthcare thing, and you're at it, and they're just like, oh gosh, shut up, But look around here. You all want to talk to each other about these really interesting healthcare subjects. So again, Walter and I will be sending out some information. We have started accepting applications, and that's gone out on a number of platforms. But if you haven't gotten that, just email me and I can get it to you. Yep.
The QR code for this site isn't working.
For this one?
Yes.
Okay. Well, we'll fix it. Definitely. Thank you for letting us know. I'll let Walter take a look at that and we'll fix that. Also, Business of Health undergraduate minor applications are due the 25th. So if you are an undergraduate interested, short time, but it's a great minor. We are so excited to have students. We had our first group of 35 this year. We're going to be accepting another 35. Again, too, you get to take courses from from Dean Stats, from our other great faculty members as well. So look into that if you are an undergrad and interested. Now, IPEP, if you're not familiar with IPEP Distinguished Scholars, I encourage you to do so. Coming today actually counts as an event. So as long as you have, I think it's within a month now, barring there are a few grandfathered folks, but the Distinguished Scholars Program, it's really awesome. You get to meet students from across campus. You get to be involved in many events. We have something called Meet Your Neighbors, which is the core for business, which we do with biomedical engineering and education, and then also others around campus. So we get together and solve some interesting medical device problems. So take a look at IPEP Distinguished Scholars. It's on you. It gets on your transcript. You get a cord. We have a celebration at the end of the year. And it's just fantastic, especially if you're really interested in health. Anybody IPEP Distinguished Scholars? Woo! Yay! So I was going to say, what's your name?
Orita.
Okay, so talk to her because she'll give you some information about how fun. It is fun, right? Okay, great. As long as you're like, boo! All right, and see, these are all the folks that are involved. And you've got really great perks. They're really great people to work with. All right, I want to get you your break. Again, too, HPA are some services as well. So anybody that is going to be applying to med school, dental school, pharmacy school, any of our professional schools or professional schools beyond UNC, you've got people here to support you. Again, too, just great people. I'm going to just kind of fly through there. You can stay connected with them as well.